Okay, a focused wave has a really rapid rise, 10 nanoseconds, whereas a radial acoustic wave has a rapid rise, 10 microseconds, but it's a lot, what is that, micro to nano is 1,000 times less than a focused shock wave. Now, whether a microsecond versus a nanosecond matters, I don't know, but technically there's a difference between the rise of a focused wave and a radial acoustic wave, okay? The source of focused waves, they're either piezoelectric from a crystal, electromagnetic, or electrohydraulic. And then for a focused, for an acoustic wave, it's either, they're all ballistic, meaning a bullet basically bounces back and forth against a strike plate, and it's either electromagnetic or pneumatic. Okay, and then a focused wave is a class 2 device, which at this time for erectile dysfunction, supposedly it limits the use to physicians in IRB approved trials, whereas a class 1 device can be used by anyone. And then the critical difference really is where the energy is at. So for a focused wave, the wave comes together at a point, whereas a radial wave, the energy comes from a point and goes out. And because of that difference, the depth of penetration of a radial acoustic wave is 3.5 centimeters, a little bit less than 2 inches. And the depth of penetration of a focused shock wave is 11 centimeters. Now, I'm out in California. Maybe in Florida, you have guys with penises that are 11 centimeters in diameter. But in Florida, most guys' penises are not 11 centimeters in diameter. They're 3.5 centimeters or less in diameter. So that is an important difference. And also it's important, and all joking aside, when you're using a focused shock wave, the kidney with kidney stones is about 11 centimeters deep. And so that's why focused shock waves work really well for kidney stones, but radial acoustic waves would not work for kidney stones because the depth of penetration is, way too shallow. But for a penis, obviously there's a big difference. Okay, just a brief commercial break. I want to thank everyone out there for supporting Affirm Science, for purchasing wholesale for in-office sales to your patients. Because we get sales from Affirm, I have the time to put together slideshows like this, focused versus shockwave versus radial. I did one on PRP. I did one on GAINSWave. You can go back and look at all of the educational journal clubs that I've done. And because the GAINSWave community supports Affirm Science, it frees up a little time where I can try to keep everyone up to date on all of the developments in this really exciting field of regenerative sexual medicine. Okay, so the devices. On the radial side, you have the Zimmer device, which costs between $30,000 to $40,000, and it's a class 1. You have the EVIE device, which is about $30,000. You have the Refine USA, which is about $40,000. And you have the Stores Deactor, which is about $25,000. The focus devices, because the technology is a little bit more complex, tend to be more expensive. So the Eurogold is about $60,000. The Stores Duolith is around $60,000, and the Alma Duo is $180,000. That's to me, that's a stunning amount of money for a focused shockwave device. For $180,000, it would not only have to improve erectile function, but maybe vacuum the floors, clean the sinks, answer the phones, and do the accounting. That $180,000, I don't know why it's so far out of range from the rest of the machines, but that's the cost that we were quoted. Okay, so There are only 2 papers comparing focused and radial waves, but I want you to take a look at this homemade diagram first. So on the left, we have a radial wave, right? So the highest energy intensity is at the tip, and the energy radiates outward. And then the 2 red lines are basically meant to be the penis, right? And so you have a fair amount of energy that's going through the penis, and what it's doing really is shaking the cell membranes of the endothelium and the vascular cells, stimulating stem cells, causing the release of vascular growth factors, and creating neoangiogenesis, the growth of new blood vessels. Okay? And then on the right, you have a focused shock wave. Now, the question really is, where is the focus of the focused shockwave device? Okay, but think about it this way: when we do shockwave therapy for kidney stones, we're focusing the energy on a kidney stone, and usually the focal field is about a centimeter and a half, but that's because we're 12 centimeters deep. The penis, if you focused all of that energy of a focused shock wave in the corpora, I think that you would cause tissue damage, because that would be the total intensity of the shock wave. So the focal point of the shock wave of a focused device is going to be somewhere outside of the corpora. And so I'm having trouble really understanding what the true benefit of a focused wave is if the focal point is not in the tissue that you're treating. So to me, in my sort of simple understanding, and maybe some of you guys are physicists out there and know this stuff better than I do, but the wave, the main difference between the wave is just the rise, but it's microseconds versus nanoseconds. And then really the intensities are fairly similar. The focal point of the focus wave is outside of the penis, so you're just getting these spiked waves coming through the tissue. And so I'm not really sure biologically why there would be a difference between a radial and a focus wave. But I would, if there's someone out there that's smarter than me about this kind of stuff, I would welcome any thoughts. Okay, so let's get down to the 2 papers. The first was written by a good friend of mine, Danny Shaskas. He is a professor at the Cleveland Clinic, and he did a retrospective comparison of focused shockwave therapy and radial wave therapy for men with erectile dysfunction. Okay, and this, I think, was a 2020 paper. Okay, so it's a retrospective study. There are 2 different sites. One's actually in the Cleveland Clinic and one is a satellite clinic. The protocol was 6 weekly treatments. The radial device was the Zimmer on-pulse radial device, 10,000 shocks, 90 millijoules at 15 hertz. I have a Zimmer. I find that it works pretty well. And I use a very similar protocol that Danny does. 10,000 shocks, 90 to 100 millijoules, 15 hertz. The true shockwave device was a Eurogold, 3,000 shocks at 0.9 millijoules per millimeter. And what they did is they checked the pre and the post SHIM scores. And important to note, no adverse events encountered with either technology. No paper that I've seen reported in the literature any significant side effects from any of these technologies. Okay, so these are the baseline characteristics of the 2 treatment populations. Very similar age, very similar duration of erectile dysfunction, very similar rate of use of PDE5 inhibitors, a similar number of treatments, and a similar pre-treatment SHIM score. Okay, so let's see what happened. Okay, so the focused shockwave therapy started at 9.3 and went to 15.5. So pretty good, that boosted the SHIM score about 6 points, which is great. It's a big improvement. It moves you up one class of erectile function. Okay, let's take a look at the radial. Started at 9.3, post-treatment went to 16.1. Wow, that's pretty good too. So that's an improvement of about 7 points on the SHIM score. So that also is a really good outcome. So let's compare now the focused shockwave, which improved 6 points on the SHIM, and the radial shockwave, which improved 7 points on the SHIM. But a p-value of 0.4 means that there's really no significant difference between a 6 and a 7. So in this comparison, I would say that it's no difference between focused and radial shockwave. Okay, so that's just one paper. Let's go to, there's only 2 papers, remember? Let's go to the second paper. This one is out of Turkey, the Department of Urology of the Van Educational Research Hospital in Van, Turkey. And this was done in 2019, and looks like it was published either 2019 or 2020. So these are all very recent papers. Okay, so the methods for this, they used an old protocol of twice a week for 3 weeks, then a 3-week break, and then twice a week for 3 weeks again for a total of 12 treatments. So Cleveland Clinic used 6 treatments, they used 12 treatments. They used a device called the Elettronica Pagani. It's an Italian device that I'm not familiar with, but I guess there's 2 different modes. There's a focus mode and a radial mode for this particular device. And they used 1,800 shocks at 0.15 millijoules per cc. And they checked the IIEF, which is 5, which is basically the SHIM score, and then the EHS, which is the erectile hardness score at baseline and then 3 months after treatment. Okay, and so the age of this group was basically the same. The body mass index was similar. The testosterone levels were similar. It's interesting to see 85% of these 45-year-olds were smoking, and that's why they were getting erectile dysfunction at such an early age. 45% had high cholesterol, so they're eating too much pasta, I guess, in Italy. Oh no, Turkey. What do they eat in Turkey? Hummus? Hummus is good for you. I don't know, something, these guys are smoking, they're eating bad food, they have hypertension, over half of them have diabetes. And so this is even though it's a young group, it's a relatively unwell group. All of them are treating themselves with PDE5 inhibitors, and their baseline IIEF-5 score, 9.6 and 10. So very similar. Okay, so let's take a look at the focused group. The IIEF-5 went from 10 to 15. So that's pretty good result. And the erectile hardness score went from 2.1 to 3.4, which also is a pretty good result. So this young but unhealthy cohort of Turkish men got a good result from the focused treatment. Now let's take a look at the unfocused treatment. The IIEF went from 9.6 to 15.9. Wow, so even better than the focused. And the EHS went from 2 to 3.72. So there again, a little bit of an edge to the unfocused versus the focused. But when you take a look at the p-values, when you're looking at an increase of 5.5 versus 6.5, you're not going to get much of a p-value. So basically, statistically, these are similar values. When you look at the percentage of patients that had a treatment success, the focused benefited 50% of men, and the unfocused benefited 65% of men. Okay, so let's sum up. Cleveland Clinic study, no difference between focused and unfocused or radial. The Turkish study, no difference between focused and radial. And when I was getting ready for this talk, I called up Danny Shaskas, who's a friend of mine, and I asked him point blank. I said, Danny, I saw your paper. I saw the Turkish paper. I said, but, there's all these claims being made that focus works better, et cetera, et cetera. What do you believe in your heart of hearts? And he said, I don't think that there's really any difference in terms of the efficacy for this particular indication of focused versus radial. And Danny's a really, really smart guy. He runs the board review course, and he's a professor at Cleveland Clinic. And so if, I believe the kind of stuff that he says. Okay, so, but what about other studies? Like, are the studies that I just quoted to you, are they way out of line with everything else that's been put in the literature? And so there was a meta-analysis from Clavijo that showed a SHIM score increase of 6.4 versus a SHIM increase of 1.6 for sham. So, the numbers that we're getting here, between 5 and 6, they're consistent with those meta-analyses. And then if you take a look at the other 5 meta-analyses from Liu, Dong, Campbell, Rurdink, and Baccalini, they all show an increase of SHIM score of these technologies, mostly focused between 2 and 4.2. So, I wanted to see, like, okay, these two studies that compared focused and radial, were they aberrations or were they pretty much in line with other things that we've seen? And basically what it shows is they're pretty much in line with everything else that we've seen. So there's no reason not to discount. There's no reason to discount the data in those studies. Okay, so what about other fields using shockwave therapy? So orthopedics is a field that uses shockwave therapy, both radial and focused. And they use it for things like biceps tendinopathy, knee tendinopathy, plantar fasciitis. And there was a meta-analysis of focused shockwave and radial shockwave in soft tissue musculoskeletal injuries. And what it showed were that, one, they were both equally safe, which is great to know. And then there were varying efficacies, but there were no head-to-head comparisons, right? So in a field like orthopedics, where this is used in a widespread manner for a number of different medical conditions, they really haven't shown a difference between focused and radial shockwave. Okay, so just to beat a dead horse, the 2 comparative studies show no evidence that focused shockwave is superior to radial acoustic wave therapy in the treatment of erectile dysfunction. In fact, they are statistically no different, and non-statistically, the radial shockwave actually outperformed the focused shockwave by a little bit in both studies. The outcomes of these 2 studies are consistent with the existing literature. So it's not like these 2 papers are an aberration. The numbers and the results that we're getting in these 2 studies are pretty normalized. In orthopedics, there's no direct comparison of focused versus radial, but both technologies are safe and effective, and neither one has been found to be superior to the other. And focused shockwaves are more expensive than the radial wave machines, especially the Alma Duo, which is 2 to 3 times the cost of even the focused shockwave machines.